Good afternoon to all my respected teachers, my guides, seniors, and colleagues. So today I am Dr. Shangita Mukherjee is going to present the progress of my thesis in Masters in Health Professional Education. The title of my topic is the evaluation of knowledge perspectives of medical students and teachers on physiology electives, a quantitative and semi-qualitative study from a rural medical college of West Bengal. My guide is respected Professor Dr. Alka Ravekar, Madam. So this is the title of the study. So first is the certificates. So I have received the Institutional Ethics Committee Clearance Certificate. The memo number of the certificate is IEC 03/25 dated 16/4/25. Regarding the plagiarism check, I have used two tools. One is the Microsoft 365 tool where it shows that there is only 9% of my text is similar to the online source. I have also used an online free plagiarism checker, that is PaperSoul, which shows 0.0% similarity. So this text is original and unique. First come to the introduction of this study. Introduction or background. So we all know elective courses are fundamental for medical curriculum, and the new competency-based undergraduate curriculum for the undergraduate medical students, it has been ushered in by NMC from the year 2019. And in this new curriculum, NMC has initiated elective module for the first time in India. The objective of elective module, as mentioned by NMC, is a learning experience created in the curriculum to provide an opportunity for the learners to explore, discover, and experience as our streams of interest. Now, in accordance with the NMC guideline, elective is a zone or course that, as specialty, will allow the students to learn and require something unique. Now, even the super specialty departments which are not involved in undergraduate teaching can contribute to electives. The total duration of elective is 1 month. It was split into two blocks, block 1 and block 2, each having duration of 15 days. In the block 1, the preclinical departments, anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, forensic medicine, and toxicology, they are included. In the block 2, clinical, broad specialty, super specialty, and community clinics were included. Electives were imparted at the end of phase 3 part 1 and before the beginning of phase 3 part 2. Now, the knowledge gaps. So why we have taken this module or technique? Basic science and clinical syllabus, both we know that prevails the strongest basis of medical curriculum. But little is known about the concern of students about the elective allotted to basic science departments like physiology. Department of Physiology in our institute, that is Rampurhat Government Medical College, is allotted two elective topics: pulmonary function test or PFT, ECG or electrocardiography. Now, research question, we can say that thus participation in a structured elective module of PFT and ECG, they can improve the knowledge, clinical skill, and confidence of MBBS students. And what are the students and faculty's perception on this module? So research hypothesis. So the null hypothesis is that implementing PFT and ECG elective module, it will have no significant effect on the knowledge skill development and confidence level of undergraduate medical students. Alternative hypothesis will be, if we implement these two elective modules, there will be significant improvement in the knowledge, skill development, confidence among the undergraduate medical students, and it is perceived positively by both students and the faculties. Now the objectives. This study was undertaken to assess the perception of students and teachers regarding these two elective programs, and it also tried to elucidate the knowledge gained by the students at the end of the electives. So the methodology. First is study design. This is a descriptive cross-sectional mixed method questionnaire-based study. The current study followed parallel mixed method design with an initial quantitative survey of pretest post-test score. To study the perception of the students and the faculties, we have used the pre-validated questionnaire. This was followed by a qualitative study by focus group discussion. This approach, that is both quantitative and qualitative, it actually helps to guide the discussion questions of the focus group, and it also helps to corroborate the findings of the survey, thus providing for the methodological triangulation and greater rigor of the study. Now, this is in nutshell the study design. Students they who took the PFT, in this case it is number is 15. Students who took ECG as elective is 15. So first they will do the pre-test immediately prior to the onset of the module. Then there will be 2 weeks elective module will be done. After that there will be post-test of this topic, and the pre-test post-test scores will be compared. Then there will be the questionnaire, validated questionnaire will be given to study their perception. After that, the thematic analysis of this questionnaire will be done. The teacher's perception will also be carried out by the question by a validated questionnaire, and the focus group discussion will also be done. Now the methodology, the study duration is 15 days as stipulated by NMC. This is the time for block 1 elective, and study area is the Physiology department of Rampurhat Government Medical College. Study population whole 30 students who took PFT and ECG as elective. Inclusion criteria all 30 students who took PFT and ECG as elective. Exclusion criteria if any student does not give consent. Now the sampling technique. Purposive sampling with complete enumeration technique or census, it was used. That is, all students who have enrolled in the physiology elective and fulfill the criteria, inclusion criteria, will be incorporated. They were incorporated in the study. Sample size was 30. Now the sample size formula is this one, where n is the required sample size, z is the z score, and p is the estimated prevalence, and d is the desired margin of error, where we took 5% margin of error, 95% confidence interval, and 50% outcome responses. The estimated sample size, it became 16, where the population was 3000 students, because total number of students under West Bengal University of Health Science who are eligible for the elective was around 3000. Now the study module, what the students will do in these 2 weeks. In case of ECG, in the week 1, after pre-test, there will be an ECG introduction. They will learn the ECG placement, the lead placement. They will do ECG on the healthy subjects. Correct lead placement and attitude and communication with the subject will be studied. And the privacy of the female subject especially, they will learn how to maintain it. In the week 2, they will do ECG and interpret prayer interval, heart rate, axis, and the overview of arrhythmias of abnormal ECG will be given. After that, there will be post-test. They will maintain a logbook. And in case of PFT, as we do PFT in our department, we do the patient service. So in the week 1, they will learn about the theory introduction of PFT. Then they will observe the patient, explain the patient the procedure. Then they will enter the data, that is height, weight, all this, smoking history. And in the second week, they will perform the patient under supervision, at least 2 patients by each students. Then they will observe the reversibility test. They will interpret at least 5 spirometry results. Then each group will give a PowerPoint presentation, and scoring will be given as a part of the formative assessment. After explaining the purpose of the study and taking informed consent, online survey will be conducted. It was done with a validated questionnaire which was developed by the author after the series of students and staff's focus group discussion. It was again validated by 3 experts in the field of medical education. The questionnaire was sent to the students who took part in 2-week electives in 2025 via Google Documents. Then the focus group discussion. To further strengthen the finding of the survey, 2 focus group discussion was arranged, 1 for each batch, and it was conducted. Informed consent was obtained from each of the participants before we started the FGT. So what are the study tool we have obtained? First is the pre-test post-test score, then the validated questionnaire for recording the perceptions of electives of students, questionnaires of recording perception of electives of faculties, and verbatim transcription of the FGD. Now what actually present in this validated questionnaire? It is an anonymous self-administered English language questionnaire which has 12 survey items for gathering participants' answer. Out of these 12 items, there was 2 items for the demographics, 10 items seeking students' response on a 5-point Likert scale from strongly agree to strongly disagree. One item concerning mainly about the reason why they took this PFT and ECG as elective, and 3 item was open-ended question asking the participants for their opinion on strength, weakness of the program and their suggestions to improve it. An online Google form was used to create the questionnaire, and all participants were sent it to by a link via email or WhatsApp group. Now, teachers' questionnaire is also there. Another cross-sectional questionnaire survey was conducted among the faculty members who took actively part in the elective module and implementation of it. Now come to the focus group discussion. 2 focus group discussion, one for each batch, was carried out. Focus groups were formed randomly with 10 students each from the ECG and PFT electives. Discussions for each group were scheduled as separate 1-hour session. At the time of focus group discussion, we obviated questioning the participants and letting them reply to the questions one by one. We made our participants easygoing to non-conquer with each other, if any. If they do, there may be some conflict between them also, and we also allowed them to voice their conviction by group discussions. Our aim was to make reciprocity among the participants. So the final questioning route comprised of the 3 following questions. What is your field related to elective modules during your training days? What are the impediments rooted in these modules? Are there any ways to surmount these difficulties? Now, the focus group discussion was audio recorded and decoded by one of the members of the research team. Analytical process started by using verbatim transcription and recognizing the participants' impression. Participants were informed on the session being recorded, and verbal informed consents to the audio taping was procured from all participants. They were fully autonomous and had the liberty to leave the study as they preferred. The objective of the focus group were explicated at the commencement of the session. Participants were pledged that the procured information would be used for any would not be used for any purpose except the research, and their identification would remain private. 2 such focus group discussions were conducted. How long? Now, up to the time of data saturation point. So, when there is no further new concepts and ideas appeared in the responses of the participants. Now, focus group transcription. The qualitative content analysis was executed according to Granham and Lundman. In this context, the transcript was read meticulously and repeatedly to attain an overview of what talked over during the discussion. The unit of analysis, which is crucial in a content analysis, is a segment of text that is comprehensible by itself and contains one idea or piece of information. Subsequently, each data unit was condensed and allocated a code. Similar and different codes were labeled and amalgamated practicable. Similar and different codes were labeled and then categories aroused by grouping the codes, meaningful units stating similar or different ideas. At last, we employed a general theme for the arrows categories. All transcripts were autonomously coded by 2 researchers, administering as many codes as feasible for each data segment. All coding and categories recognized were arranged in research members to confirm iterator reliability. Any obscurity or conflict concerning the coding were fixed by exchange of ideas between 2 coding researchers, and in case of non-reaching unanimity, a third member of the research team was mediated. As every qualitative research should reinforce the credibility, transferability, dependability, and conformability, we also try to do this. What is credibility? Credibility is the ability to demonstrate that the study is accurate. To meet the credibility, our researchers had diverse field experience and sustained commitment in all processes of the study. In addition, the procedure of data collection and analysis was scrutinized and reviewed by the research team. Then the transferability means unblocking insights of diverse concepts. With reference to transferability, our researchers attempted to furnish full narrative of the context of the study. We also undertook to have sufficient talk regarding the outcomes which already published works. it should be observed that examining several frames of references and the handling of direct quotations during the delineation of observations, it actually improves the transferability. Now, dependability, can it be trusted? For dependability, we followed the code record approach. From this perspective, we coded our data twice by two members of the research team. We then matched data to see if any disparity were recognized. Now, conformability, as regard conformability, a qualitative research specialist was solicited to check the coding and analyzing process. Data triangulation was achieved through multiple data sources. Now, the data analysis. Microsoft Excel 2007 was used for data entry and statistical analysis. Thematic analysis was used to examine the qualitative data, and the proportion were reported as percentages. Data analysis of the focus group discussion. Now, each member of the analysis unit reviewed each group transcript separately, noted keywords, phrases, and measured themes, both in response to the specific questions asked and as they spontaneously emerged from student comments. The responses was then entered into an Excel database, with each sheet in a file being used for each question of FGD. The coding column was filled during the next phase of analysis, but the categories will be synthesized both by deductive and inductive process. Now come to the result. In the table 1, we can see the out of 30 students who took ECG and PFT as elective, 14 were male and 16 were female. The standard deviation of their age was 23 plus minus 1.18 years, and their attendance was 100%. And ECG and PFT was their first choice in 26 students and second choice in 4 students. Then then we have in the figure 1, it shows the pre-test post-test score distribution. The QQ plot, Shapiro-Wilk test, and Komolgorov-Smirnov test was employed to indicate whether the pre-test post-test score was normally distributed or not. And it was seen that they were normally distributed, both because both Shapiro-Wilk test and KS test, they were non-significant. Now in the table 2, it demonstrates the t-test result, which depicts there is significant increase in knowledge of students in both ECG and PFT. This is the combined score of ECG and PFT. We also tried to find out the separate scores. For example, in table 2b, we can see the pre-test and post-test score of the ECG. It has significant gain of knowledge, as a p-value is 0.0038, and in case of PFT also there is significant increase in the knowledge gain. So it is a comparison between the pre-test and post-test score. On the left hand side, we can see the combined score of ECG and PFT. On the right hand side, we can see the separate score sheet for ECG and PFT. In both the cases, post-test scores are much more greater. Now in the table 3, we can see the majority of the students of both ECG and PFT electives, they agreed that objectives of the elective modules were clear to them. They strongly agreed with that. And the program met their academic needs. They had adequate supervision and hands-on clinical training, appropriate amount of communication skill with patient, peers and clinical staffs. They came to know how to maintain privacy while doing clinical tests, and they made their expectations. Then we have the figure 3, which